Guttate psoriasis is a strain of psoriasis which manifests itself as tiny, salmon-pink droplets on the legs, arms, chest, and scalp. These areas are about a centimeter across and usually clear up within several weeks. The condition can, however, be chronic and could be triggered by other infections. This form of psoriasis is common among kids and young adults of both genders. Guttate psoriasis may be triggered by a past streptococcal infection. About 80% of the victims have a past streptococcal ailment, such as pharyngitis or tonsillitis. Viral infections like rubella and chickenpox may also trigger outbreaks in young children. Special white blood cells, known as T cells, cause an unusual inflammatory reaction in the skin and the excessive production of skin cells. The condition is also hereditary. Tiny, red or salmon pink spots normally appear on skin about 2 or 3 weeks after a streptococcal ailment. These drop-like blemishes are usually itchy. The outbreak begins on the arms, legs, and body, spreading to other areas such as the ears, face, and scalp. The palms and soles of the feet aren't usually affected. Symptoms of chronic psoriasis, such as nail changes, ridges and pits, could be absent. One needs to see a doctor if they have a sudden rash. For guttate psoriasis, the eruption may be in the form of small red dots which may last from a few weeks to several months. Most people see this form of psoriasis as a minor inconvenience. One, however, needs to have a diagnosis performed because the eruption could develop further into chronic plaque psoriasis. The diagnosis involves examination of the lesions on the skin. If this is in doubt, one may be referred to a dermatologist. In most cases, skin biopsies aren't necessary for a diagnosis to be confirmed. A blood test can be performed to ascertain whether one has recently had a streptococcal infection. A mild topical steroid cream may be prescribed to combat itching and inflammation. Vitamin D creams and coal tar creams could also be prescribed, though these are usually used for plaque psoriasis. A skin-softening moisturizer could be sufficient treatment. The choice of remedy depends on one's preferences and severity of the condition. More resistant cases may be treated using a combination of psoralen drug with exposure to ultraviolet light using psoriasis lamps. Thanks for watching. Don't forget to subscribe.